Welcome, ladies and gentlemen, to this week's episode of the Essential Therapies Podcast with Dr. Cindy. In today's episode, we have an MFR patient testimonial with a woman named Carolyn. And she has a great interview with Dr. Cindy talking all about her journey with myofascial release, how it helped her, how she got to where she is today, and the importance of just simply trusting the process. So we hope you enjoyed today's episode, and we will see you again next week.
Thanks for joining us today on the Essential Therapies Podcast. We are trying something new, and we are here in our Toledo, Ohio studio and treatment room 3 to be exact. And we're giving this a try for the first time. And I'm super excited because I have a really special guest here today. And it's the first time I've ever been able to interview in this type of a setting, for sure, a patient who has experienced some really wonderful results with the John Barnes myofascial release treatment approach, which is what we like to think of as our main essential therapy here at Essential Therapies. And so my goal is to really try to educate more, to let people know what this method is about, why and how it's different. And there's just so much misinformation out there, even though it's great that there's more information lately about fascia, but still not a lot of people know what the word biotensegrity means necessarily. And so this is part of our journey of educating and sharing. So without further delay, I'd like to introduce to you Carolyn Petrie. She is an RN and has been an RN for 40 years-ish, and she has a really great story. So, Carolyn, how about sharing with us, first of all, how you found us and what brought you to even look for myofascial release?
Well, I had a couple spine surgeries, and I had a cyst on my spine that was removed, and the first surgery failed, and I had to have a fusion, and just started having a lot of issues with pain after those. And I had done a lot of traditional therapy, physical therapy, chiropractic. I did acupuncture. I had done lots of different modalities, and nothing was helping me. And I had gone to so many doctors, and nobody could figure out why there was the problem or what the problem was. Anyway, so I knew a little bit about myofascial release, not a whole lot, but I Googled it, and that's how I found you.
Great. Google is good for a number of things, right? So you mentioned a cyst or on your spine, but were you having other back pain problems?
Yeah, well,
related?
I was having a lot of pain, it was on the left side on my hip mostly, and I thought it was muscles, pushing stretchers, whatever, work. And, but it got to the point where I was having a hard time lifting my leg, like to put on my pants. And I went to the doctor, and anyway, they thought it was my hip. So they did an MRI of my hip. And that showed that I had a tear in my hip joint. So I had a hip surgery, arthroscopic, to repair the tear. And in the midst of doing that, they did an MRI and found this huge cyst on my spine on the left. Okay. So that's how I...
So you had all of that done in a fairly close amount of time?
Yeah, 2015, within about 2 months of each other, I had 2 surgeries.
Okay. So I have a couple questions for you prior to that, like just what your life was like activity-wise and with being a nurse. Were you the type of RN where you're caring for, like helping to lift them, like in a hospital type setting? What was your job strenuous
at that
level
point
like?
in my career? I was working in a department where we did X-ray guided invasive procedures. So it was almost like a surgical. Okay. But I had done ER for many years, moving people all over the place. But anyway, I had to wear 10 pounds of lead for every case that we did, because it was all X-ray guided. Okay. In the surgical room. So I was doing that, and I was getting people on and off the table, things like that. Okay.
So when you started having this hip pain, was it something that gradually came on? Was that like your first inkling of a problem, or did you have other history of back pain? I know a lot of times people have nothing. It just kind of came up.
It just started coming on. And like I said, I thought it was just muscle pain. For a long time, I thought it was muscle pain. I didn't do anything about it.
Right. So you had the second surgery for the back.
Right.
And then what happened? Tell us about that.
I had a partial fusion in that L4-5. The facet joint is where the cyst was, and they had to remove it. So they had to fuse the facet joint with the bone graft.
Okay.
And after that surgery, honestly, I felt great. I felt like $1 million. And I went back to work. And within, I don't know, 6 to 9 months, all of a sudden the pain came back. And long story short, I had another MRI and the fusion had failed and the cyst came back.
Wow. So then what were you looking at?
Then I ended up having a full fusion, rods, screws, L4, L5.
Okay, so just that segment there.
Yeah.
Okay. Mm-hmm. So how was your pain directly after that?
Well, it was interesting because directly after that, all the left-sided stuff was gone, but I had all this pain on the right side, which I'm like, what's going on with that? And I remember the surgeon saying, no, it's just swelling, but it stayed there. And in between those two surgeries, at some point I started having numbness in the side of my heel when I would lay on my back.
On your right leg?
On my right leg. Yeah, my right heel would start to go numb and fuzzy whenever I laid on my back. And they had told me to go to physical therapy, all this stuff. No, nobody ever really paid too much attention to that complaint. But so that started, and then after the full fusion, I had all this pain up here on my right, sort of flank area. Yeah. And then after that, over time, it was very painful down the side of my leg, up here and down the side of my right leg. And then my calf was really tight on the side. And then this cold, fuzzy numbness in my heel kept getting worse.
Okay. And by now it's starting to affect your function.
Oh, yeah.
Imagine. And you were still working as an RN at that time?
Yeah. Well, no, because we had been transferred.
Okay.
Out of state. So I was not working at that point.
Okay.
But it was to the point where it was mostly bad at night. Like I couldn't sit for long at all. I couldn't sit for more than 20 minutes, like to go on a trip in a car or, to watch a movie. I just couldn't sit. And I, go into a restaurant, I couldn't sit on a low chair. I had to be up on a high top. And it was terrible. When I think about it now, I was very limited in what I could do. And, I had all these injections and steroids and all this stuff trying to figure out what it was. Nobody could figure it out. I did so much therapy and nothing.
Nothing got better.
Nothing got better. And at one point, they started talking about putting a nerve stimulator in my back. And I was like, no way. I knew enough that there was something being compressed in there and I'm not going to do that. So anyway, and then after that, I started having issues. This shoulder kept hiking up, and I started having a little bit of tingling in my left hand in my fingers, and then of course I go to the doctor and they do an MRI and they found some little minor disc bulges in my neck, but they said there was a little bit of cord compression. And they wanted to do a fusion in my neck. And I said, no, I'm not having another fusion. Long story short, I found somebody to do disc replacement surgery. Okay. And they replaced 2 discs in my neck, so I still would have motion and movement.
Okay. So during all that time of you getting this neck taken care of, you've still got this legs, low back going on.
But that kind of got, pushed to the wayside because this. And so then I had that done.
Did anybody during all this time say anything about these two areas being connected?
Never. The thought from the medical community at that point from my doctors was like, you must have you got nerve damage from your surgery. But the ankle stuff started in between the first 2 surgeries. Okay. So, I didn't really quite. That didn't make sense. Nobody could figure it out. Nobody, I don't know what's wrong with you, but they just thought it was just nerve damage. Okay. I had an EMG. The guy did the whole thing. And at the end of it, he said, I have no idea what's wrong with you.
And then when you started with this neck problem and your arm problem, then this of course, in our medical system, everything is set up with a diagnosis code, and it's like you have the code for that area that they're treating, and that's as far as it looks, right? And that was kind of the case here. They were treating your arm or your neck and that radiculopathy sensation, and didn't say anything about it being in relation to anything else going on.
No, that was never even brought up at all.
Yeah.
And ironically, the neck surgery didn't really do much. It was it was a horrible thing to go through, and it didn't really help me that much at all.
So how long after your neck surgery then did you start thinking outside the box, and the word myofascial came up for you?
I came here a little less than a year after that surgery.
Okay. Great.
Yeah.
And we just realized that Carolyn is coming up upon her 2-year anniversary with us. So talking a little bit about that, I'm really curious, what did you expect? Like, you made that phone call, you did some research, and then you came and you saw me that first treatment. Did you have any expectation? Do you have any idea what you were walking into?
No, I really didn't. I mean, I knew there would be some sort of manipulation and work on releasing stuck fascia, but I really didn't know that much about fascia at the time. I mean, I had a general idea.
Did you think it might hurt, or did you have any ideas about like what the treatment itself?
I probably thought that it would hurt, but I didn't care because if it could help me, pain wasn't an
at that point. You already had it. Yeah, and I asked that question because so many times people think that already. They're like, okay, it's myofascial stuff. They expect it to hurt. Like they're and some people even avoid it because of that,
Oh, yeah, I know.
And of course we do not force the tissue ever. And it's very gentle and very comfortable, although I should let you speak to that. So after you had that appointment, did you start, at what point did you start to have some hope, or did you start to realize that this was all connected? Even?
Oh, well, honestly, after talking to you that first day, I had hope. And when you showed me that poster right over there, the myofascial man, I thought that was me. I got this, this hip is up and this shoulder's up, and and it just was like, okay, this makes sense.
Yeah.
And before, oh, well, you got this, we have to do this. Yeah. Nothing, made sense. So that gave me hope.
Yeah. Well, I love that you bring that up. Actually, our little fascia man is something that I show everybody because so many people can relate to that. And we're looking at the skeleton, and then we have areas that are colored representing fascial restriction and how that pulls on the skeletal system and changes the alignment. But if we don't treat that fascia that's restricted, then the skeleton or all the structures, every single cell of the body is really going through the fascia. The fascia is going through it as a scaffolding. So we can't treat the entire body and ignore the fascia because it's just all part of it. I think that's where the problems arise. Is you get the testing, you have MRI, X-ray, CT, all of that, it's invisible. Yeah. So when they say to you, well, you must have just had this nerve injury right during the surgery, like they're hypothesizing because they can't see anything, right? I mean, this is what we're always looking for in medicine, whether it's a disc, and you mentioned the little disc in the neck and all these different things. So when I hear a story like yours and I show the fascia man and try to help you feel these connections in your body, it's a lot of time. I love seeing the eyes pop open, like, yeah, that makes sense. You start to be able to relate to that. So
yeah, absolutely.
So you've certainly had a long ride with all of this, and you've had a lot of just symptoms along the way. Can you speak to that a little bit? As you remember your journey, especially from that first appointment, and you started to get some hope, and are there any keystone moments that come up to your mind when I say, when did you really start to feel, or is there a moment where you start to feel relief? And what was that like for you?
From the get-go, I had such a leg length discrepancy, and that, after being here for an hour or 90 minutes, whatever session that I was doing, you could get that to be corrected that quickly, and nothing ever hurt. Nothing ever hurt. It was all very gentle. But I remember you telling me about do you feel that sort of like taffy pulling feel in your leg? And I did. And I was like, oh my gosh, well, that's everything moving, even at that early of a stage, So
yeah, and we hold these releases for so long. I think. Do you remember that at all? Thinking about like nothing's happening there for a while, as we're being so gentle and waiting.
I think I felt that taffy pull on the first day.
You did. I remember that.
Yeah. I always thought the longer holds made sense, because when you go to traditional PT, do this for 20 seconds, it never.
You never noticed
traditional physical therapy never helped me. Excuse me.
Yeah. Well, that's okay.
Yeah. and so when the holding longer for longer periods of time was like, okay, duh.
And you're not alone in that. I mean, I've been doing this work over 27 years now, and this is what I hear all the time is that people get frustrated doing traditional physical therapy. There's nothing wrong with traditional physical therapy. And sometimes it fixes everything and it's wonderful, but there are so many times that it doesn't. And, that's what I see all the time is that population who've tried this over and over and strengthening doesn't work, or the modalities that they're using or the other techniques just aren't reaching it. And it's typically because they're not holding with the proper amount of tension and force and getting into the system in a gentle enough way, stopping at the barrier and waiting long enough. We know now that it takes a good 5 minutes to really get the collagen portion of that fascia to start to change. And when it's been, especially when there's been surgery, because now we've got not just restricted normal fascia, we have now scar tissue where the body has laid down even more collagen and just as quickly as it can and haphazardly as it can to heal us, right? And so then you start to have these other problems that can come up, which you experienced now on the other side of your body. So, at that point, when you finally came to us 2 years ago, can you recall some of the things that you really enjoyed doing that you weren't able to do anymore? Of course, you mentioned you could only sit about 20 minutes at a time. That's huge. Is there anything else that you just kind of thought, where am I headed with this?
Yeah, I mean, I had ups and downs. I can remember having a dual treatment here, and it was really intense. It was just really amazing is a better word. It was,
and by dual, let me just
with two
interject.
therapists,
Two therapists, right,
at the time, and it was kind of mind blowing. The things that happened and the way I, could feel things moving, or but then afterwards I had a lot of pain for a week. And I remember, oh my God, what did I do? This is too much, worried about it. And you very graciously explained the healing crisis.
Right. And thanks to that interview with John Barnes himself, where we talk about that too. So that was probably a little bit scary, but you trusted the process.
I trusted the process,
which is the other piece of it. So
that's huge.
Yeah. And then as you get to the other side of that healing crisis, do you remember feeling?
Oh yeah, I could sit. I got to the point, and I don't know exactly when I realized it, but I could sit and watch a movie, or I could drive, still cut long car rides. Even to this day, we have to stop every couple hours and we get up and move.
Well, that's good for anyone.
A lot of people,
yeah, we all know
right. That. But I mean, I remember, when all of a sudden I'm like, I can watch a movie. I can sit down in the living, before I'd have to go lay flat. And I don't know exactly when that started to get better, but it was probably at some point after that healing crisis time.
So I want to bring up a little bit about self-treatment. And, almost always I give people something the very first day. I can't remember exactly what we may have talked about, usually arm and leg lengtheners or something to help you with pulling into the body. But do you have a memory of like your first experiments with self-treatment for yourself?
Oh,
yeah, let's talk about that a little bit.
I did. I think from early on, you gave me it was a piece of paper back then and the legs up the wall. And I started doing that every night. From very early on, maybe even that first night. I don't know, but maybe not quite that early, but very soon after. And I loved it.
And you could feel the difference.
Oh yeah,
after doing it.
Yeah,
great, right. So, and of course, as you know, and I'll just mention that legs up the wall is something I've been doing for very long time. I don't know, probably 25 years now, and giving it to patients for all these years. Almost anyone can do it if they can get to the floor and back up. If they can't get to the floor, I've even had people do it in bed or some other elevated position. And a lot of people are familiar with the legs up the wall because they've had it in yoga class, for example. But this isn't your everyday average legs up the wall that I teach. And it's because we're using the principles, the John Barnes principles of being in channel 3, what he refers to as channel 3. Okay. So I'm sure you remember initially me, usually I have to bring it up a few times with patients. And so over 50 years ago, John started teaching people that, if you can learn to be centered and be present within your body and be in the moment, and he would refer to that as like watching channel 3 on a TV, for example. And then channel 5 would be in being more intellectual and more analyzing and more in your head space and less in your heart space. So I try to teach people that very early on so that you can learn to be present, and it helps you feel that taffy stretching, for example. It helps you to be present. And then when we take that to our self-treatment, it's really giving yourself time to focus and be present and see what this experience of self-treatment is doing. And, I used to call it just self-care, right? But self-care kind of got muted by, you can light a candle or pour a glass of wine, and that's self-care these days, right? So self-treatment, what I mean is that we're really tapping into our total body myofascial system, this continuous web from head to toe, which goes through everything. And we arrive there fully in our bodies, in our heart center, and feeling and allowing and letting go. And in that consistency of doing that, and all the different positions in legs up the wall that we do, where you can feel and listen to the body, is really powerful. So the fact that, I have to applaud you because, we can only do so much as therapists, and your healing is so important based on what you do and how you treat your own body,
right.
How you arrive, how you show up for yourself. That can be everything from showing up to appointments consistently to every day, though, taking care of yourself and taking these self-treatment techniques and actually giving yourself a treatment. Just like you're going to get a treatment, you can actually give yourself a treatment. It is such an important piece of self-love and self-care in that way, but we're using the technique as a treatment to tap into that fascia so that you can create your own taffy stretching within your own body, right? And so you were just from the very beginning someone who saw that and could feel that importance, and you kept showing up for yourself, and that really helps the process because we can see you every other, and I think for the most part you were very consistent, sometimes every week, sometimes every other week, but not very often did 4 weeks go by that
never.
That you
I don't
here,
think ever.
because you could start to feel things change. Is that how it transpired for you?
Yeah.
Okay.
Yeah.
So how's your self-treatment changed over the last couple of years, do you think?
Oh, well, now, I mean, I want to say I still do legs up the wall, and the best part about it isn't even the physical so much as the mental. I have to say that every night I go up there, and it takes me about 30 minutes or so, and it's just like, it's almost like meditation.
Yes.
It's relaxing. I really look forward to doing it. But as far as the rest of it goes, I have now when things, and I've had, neck issues and arm issues, and I've had all kinds of issues, but now I have what I need to, I know, thanks to you, what to do. And I have what I need at home. So when things crop up and maybe I'm not going to be here for a week or whatever, I can
figure it out.
Do my little thing, and
you treat yourself.
Yeah.
You know how to treat yourself.
Yeah. And it's funny because you can start to experiment too. Like, those little balls, the little, you move them around and you figure out, so it is heartening to know that you can do that.
Absolutely. It's empowering.
Yes.
Like that's the whole idea is to empower you to be able to treat yourself. And I coined this little acronym, CALM, C-A-L-M, the CALM technique. And I don't know if you ever use this as you're going through, but I know you are using the steps, even though you might not be thinking of these words, is that first the C is to connect. We have to connect and be present in their bodies, right? And then we assess. So you might be assessing, you're already probably knowing, it's been, I need to have this treatment, or I need to do legs up the wall, or I feel this kink coming on, or I'm feeling some tightness here, right? And then then you listen, you're listening to your body, you get into the position on the wall, you're being present still, staying connected, still assessing and listening to your body and moving. Either it means, I often joke, get off the sofa, move off the sofa and hit the wall or wherever you're going to do self-treatment. And move might mean move out of that position if you've had enough, or move into the next position as you're feeling and listening to your body. And so that whole process of being connected and treating yourself, knowing what you need, takes commitment and time and consistency. And you've done that, and you've really experienced the benefits of that, because
Absolutely.
now you can help yourself if you don't feel like, oh my gosh, I can't get into an appointment for 2 weeks or whatever, and this empowers you quite a bit. So that's so great to be able to see. I'm happy you've been able to experience that for yourself.
Absolutely.
So here we are now 2 years later, and let's talk about some of these other areas. So you had all this lower body stuff going on, and you had the right side, which was really causing problem. You couldn't sit for long and so forth. You had trouble with the shoulders and arms and neck. How have you seen, like, connecting the whole body now, thinking of your whole system? How do you feel you are now compared to what you were 2 years ago? Maybe you can use percentage-wise how much better you are, or maybe what still bothers you, or what's improved.
I am so much better. And, you don't even really see it in the process. It's like, it's not like I don't know if at one point I thought I'm going to come here and all of a sudden all my pain's going to be gone. Mm-hmm. But, it's like little by little, you just notice, wow, I can do that. Like, I couldn't see my blind spot when I was driving, but I did, like, it was my neck was so stiff. And I kind of just realized that the other day, like, when did that happen?
Yeah.
My shoulders are almost level. Mm-hmm. I used to be like this.
Yeah.
I had all this thoracic outlet stuff going on, and
numbness and tingling in your hand. And
that
was that even after the surgery that you had for your
neck? Yeah.
So isn't that interesting? Let's talk about that, especially as a nurse. What do they always say? Like, if the patient has complaints of numbness and tingling in their hand, and what are they always talking about?
Oh, they say, well, if it's not gone within what did my neck surgeon tell me? Was it after a year or after 2 years? If you're still having this, then, you probably should have had a fusion. That's what he told me. Wow. And if at some point, if it's not better, it's a certain time, whatever time frame he gave me, that, that's just the way it's going to be.
Yeah. They just kind of like, whatever.
Yeah. Right? And that was absolutely not true.
Yeah. And we see that often when we release that compression off of the neurovascular bundle, which is causing all of these symptoms, right? Mm-hmm. And that can be years later. I mean, I've seen patients regain normal feeling and function, even though it's been years, because what we did was we took the foot off the garden hose is the analogy I like to use, right? Mm-hmm. You step on something, or you put pressure on it, which is that fascial restriction, and the water isn't coming out the end of the hose, take your foot off and it goes. That's what we're doing with release, and teaching you how to take that compression off so that we're getting more movement and freedom in the spaces of the body. So that's great that you had that return.
Yeah, absolutely. Yeah.
Did you ever, before I started seeing you, were you taking medications?
Yeah, I never took pain pills. But I was taking ibuprofen a lot. And at some point, I don't know, maybe a year ago, they put me on gabapentin. And it seemed like it helped me sleep better at first. And it might have helped with, nothing took all that nerve, this tightness on this leg, and the fuzziness never went away. But it just seemed to take the edge off of it for a while. But, then I hated it. Mm-hmm. I'm not a pill taker. So I weaned off of it. Mm-hmm. Actually, I've weaned off of it a couple times, and then I started it again.
Thinking of it.
But now I'm off and doing much better.
Mm-hmm. So, speaking of that too, it's what kind of shines through with that statement is that, your healing was not an event. And John Barnes says this a lot, healing is a journey. It's not a moment in time that's over, right? So you do have times where you feel better, and you have times where maybe you feel worse. Healing is not a linear thing. It doesn't just like get better, get better, get better. I mean, we have, 2 steps forward, 1 step back, sometimes 3 steps forward, 2 steps back. It changes, right? I know you experienced that a lot.
I think it's always, I'm always going to do what I've learned here, and, and a lot of things are like that I've learned. Thank you. Posture. A lot of my neck issues were probably after my back surgery, posture, and I wasn't working as much, or I was, not doing as much. And posture's huge, that putting the foam roller between all the things that I've learned here to do. It's been just enormous but that's ongoing health too.
Yeah, absolutely. Yeah. It's like brushing our teeth. We're always going to be brushing our teeth.
Right.
We're always building up plaque, right?
Yeah.
We always have that.
Yeah. And I have,
You're able to use your hands.
Yeah, I can, I can open jars. I couldn't do that for the longest time.
Wow. That's so great. Just the basic things. And speaking of the posture too, I think what a lot of people don't understand, and traditional PT, we work on posture all the time, right? But what we didn't learn was when the fascia is so restricted and pulling someone forward, let's say, like you mentioned the forward posture, right?
Yeah.
The fascia gets all stuck in the front between the shoulders and the chest and the neck and so on. And you go to try to get in that good posture position, you can't fight restricted fascia. It can withstand 2,000 pounds per square inch, right? As you learned. So we needed to release this to allow you to get there. And then we re-educate the muscular system to help you be in the better place. Then you can be there. Yeah. But if you're forcing it and you can't get there, then that's the other piece of the puzzle that's often missed. But our body wants to be in this good posture, right? And yours has improved so much.
Oh yeah, definitely. That's been huge.
What's your favorite self-treatment tool that you wouldn't want to go on a trip without?
I never go on a trip without those little orange balls. Never.
Yeah.
I have a little bag. Yeah. Pardon me. Yeah.
So our balls, actually, there's one behind you too. They're about 4 inches and they're air-filled vinyl ball. They're not super hard. I have had a lot of people say, "Oh yeah, I use the ball," and I find out that they're using a lacrosse ball. Ouch.
Oh yeah.
Or even a tennis ball can be too hard for most parts of the body. So yes, learning how to use tools that are gentle and are not forcing is been such a key thing for most patients. And you start to learn to. Yeah, I don't leave home without my ball either. Yeah. I have like 4 in my car right now, and probably the yoga strap.
I was just going to say the yoga strap.
Yeah.
Excuse me.
Yeah. So we use a 10-foot yoga strap, which over the years has evolved for me because the traditional yoga strap is 6 foot long, and so I was like. At one point, I'd be like, this isn't long. I found the 8-foot strap. So we started using the 8-foot. Now we're using the 10-foot, which we can do most things with that. But yeah, my 2 favorite things are those 2 because they can pretty much pack in anywhere. And so now that you're able to travel, which is great, and getting some of your life back.
Yeah. Oh my God. I've gotten my life back. Mm-hmm. Honestly. Because for a while there, I was just I couldn't do anything. I mean, I couldn't even go out to dinner. Wow. Unless we knew exactly where we were going. Okay, only a high top, and after we wouldn't stay long. Wow, it was bad.
Yeah. So sometimes as that healing comes, I'm just reminded how I tell this to people a lot. You might not notice this huge change, but all of a sudden one day you start realizing I've had a lot more good days and a lot fewer bad days. Yeah. It just kind of gradually starts to change, I know, for a lot of people. And speaking of the value of that, some people listening to this might say, well, you've been doing this for 2 years and being here, at least a couple of days a month, can get to be quite costly. Let's just admit that, So how would you talk about that to people who are considering that?
I would say that you can, it's... You can't put a price on your health and your well-being, first of all. Second of all, you can, you're not going to stop trying to deal with your pain because it's having chronic pain is horrible. It sucks the life out of you. And you can keep, what I just kept trusting in, the medical profession and traditional medicine, and not that they don't have a place and what they don't do a lot of good. I don't mean to dog it, but for my purposes, it wasn't helpful. But if I hadn't found you, I probably would have ended up having another surgery. Excuse me. They were talking, they would have tried to go back in and, do this or that, and that wouldn't have worked. So how much is a surgery? How much is the copay for a surgery and all the, hospitalization and the pills and
and for a lot of people, lost time at work.
Yeah.
And, so many things that you can't even put a dollar value on.
Yeah. It's just, and to go through all that and then be worse. Not only it's like my neck, I wasn't at all better. I was worse after I had that surgery. So, you can't put a price on, you think that yours is as bad as it can get worse.
Yeah. Well, thankfully you put a stop to that pattern. It's so great to have you here and share your story. It really means a lot. And I know, both of us have met people over there, especially being in the medical profession yourself and the things that you've seen. It's hard to get this word out, and it's like sometimes we just want to shout it from the mountaintops, and definitely get on our soapboxes. But so this was a great way to do that today. And I appreciate you showing up for that. So you already told me your favorite legs up the wall was your favorite self-treatment. Is anything else right there on your heart that you'd like to share with anyone, or just kind of give any last words of wisdom of experience?
I would say, don't just poo-poo the idea of this because it's foreign, or because your doctor doesn't bring it up. Or I would strongly say, try it out because it really, I think it's the future of wellness. Not just, getting pain-free. It's being well. And you can't buy that.
Oh, that's a great way to end. Yeah, I absolutely agree. And things are changing, and John Barnes has always said this is the healthcare of the future. And you just said it yourself. You probably didn't even know that that's what he says at every seminar. So
I believe it.
Yeah. Thank you so much, Carolyn, for joining us. And
you're welcome.
For those of you who are curious, there's more videos to watch and podcasts. Look back at our interviews with John Barnes and so many others. And stay tuned for more information on myofascial release and other essential therapies. Thanks for joining.
Well, that wasn't so bad.
Okay. We didn't even have to stop or nothing.